If you ask most medical providers what was the first thing that we learned in medical school, they'll probably say something like anatomy or where to find the bathrooms or what a cadaver lab actually smells like. But the first real lesson, the one that many of us actually heard out loud over and over, is this: be perfect. If you don't know something, if you mess something up, someone is probably going to die. I know for a fact that when I was in medical school and we had lectures in my first year, they actually said that to us over and over and over again. And that message hits really hard. It shapes how we think, how we learn, how we talk about our mistakes. And honestly, it shapes how we relate to ourselves as humans. I'm Dr. Goodwin. I'm a board certified family medicine physician, and I am a recovering perfectionist. Today, I want to pull back the curtain a little bit on the inside of medicine, yes, but also on perfectionism itself, where it comes from, why so many of us struggle with it, and how it can become a trauma pattern in our body, and what I have learned personally on how to loosen perfectionism's grip. We don't enter into medicine as strict perfectionists, at least not this same level of perfectionism that we leave medical school with. Sure, most of us have really good grades and we color code our notes, but medicine trains you into something different, something much heavier. You miss one question on an exam and someone says, well, that could harm a patient someday. You hesitate on rounds because you're not sure about the answer, you're going to be assigned a lecture by your attending to give everyone else next week as a punishment. And if you ask for help, people raise their eyebrows and they're going to look at you like you are confessing some kind of crime. Except for some of our nurses. Those nurses that help us out when we desperately need help are my favorite people. I really appreciate you. But slowly, there is this lesson that forms inside of our minds. If I am not perfect, then I am dangerous as a medical provider. And here's the thing, that belief doesn't start in medicine. Medicine just amplifies what our culture already teaches us, that our worth is tied to our performance, that mistakes equal shame, and that our value is something we have to earn. Decades of research, like the work of Canadian psychologist Paul Hewitt, show us that perfectionism is rooted in fear, not in achievement. We have a fear of rejection, a fear of failure, and a fear of disappointing others. And unfortunately, perfectionism has been rising dramatically in the last 40 years. One major study analyzing data from over 40,000 college students found a 33% increase in what we call socially prescribed perfectionism. That is the kind of perfectionism that is a fear of disappointing others or being judged by other people. Another study showed that younger generations report significantly higher pressure to achieve, to perform, and to appear flawless, not just academically, but also socially, relationally, and emotionally. But here's the part that I'm not hearing a lot of people talk about. Perfectionism is actually, most of the time, a trauma response. When you grow up in environments where mistakes led to punishment or conflict or unpredictability in having your needs met in a relationship, your nervous system learns a very specific equation, that uncertainty can equal danger for you in the future, and that mistakes are going to equal shame. And therefore, resting or taking the chance that you might have missed something somewhere equals a risk that you can't afford to take. So we start to outrun danger, or we start to try to outrun danger by trying to be perfect. And then you enter medicine, a system that rewards hypervigilance, punishes hesitancy, and then asks you to perform flawlessly under chronic stress, oftentimes with very little sleep. Suddenly, the coping strategies that you build to stay safe earlier in life, being hyper-responsible, over-prepared, hyper-aware of other people's reactions, look like professionalism. In medicine, these behaviors are even praised. So your nervous system never gets the memo that the danger is gone. Your body doesn't know the difference between childhood survival mode and adult performance mode. It only knows I need to stay alert and I need to stay perfect in order to stay safe. That's why perfectionism can feel physical in our body, Oftentimes, these trauma responses feel exactly like anxiety. You're going to have shallow breathing, a tight chest, a little jolt of panic when you're trying to fall asleep and you suddenly think, did I forget something today? Or, oh no, I completely forgot to do this one thing on this patient, or I didn't chart this correctly. It's not about having high standards. It's about a physical body that learned long ago that mistakes weren't allowed, and it's still trying to protect you the only way your body knows how, through hypervigilance. I still remember the first time that perfectionism was cracked open and exposed to me personally. I made a mistake early on in my training. Of course, we all make mistakes, and I made multiple mistakes, but this one hit me differently. It was nothing catastrophic, but it was a real mistake. I ordered the wrong potassium formulation, not the wrong dose, not the wrong type of potassium, just the wrong way to administer it. And my attending was upset at me once he caught my mistake. I fixed it, and then I spent hours spiraling in shame, not because of the mistake itself, but because of the story that came along with that mistake in my mind. I was thinking in my mind, I'm unsafe, I'm dangerous, I need to be ashamed of myself, I need to never do anything like this again. And that voice isn't just coming from the medical community. That voice is much older. And I knew I had to tell the patient, and I did. I braced myself and went in the room and I apologized. I explained what happened, and I was ready for the patient to be so angry with me. And instead, they said, "Thank you so much for telling me." And I was stunned because that was the moment where for the first time, I realized patients don't want perfect clinicians. They want honest people. That moment helped me to recognize where perfectionism was showing up in my life. It helped me to at least rewire my brain enough to recognize where it was and when it was happening. The perfectionism didn't disappear overnight after that. In fact, I'm still struggling with it, but it planted a seed so that I could start to heal. Even years after that moment, perfectionism still shows up for me everywhere. It's in how long I stayed after work, how many times I would reread a chart or change one sentence, and how tense my shoulders would feel every single day. Because perfectionism isn't just a mindset, it's stored in our nervous systems. What researchers see in our fMRI studies, which is the MRI machines that have the little colored areas that light up, perfectionists have increased activity in the brain's anterior cingulate cortex. That is the region involved in detecting errors and monitoring for mistakes. And this heightened activity shows up even when no error has been made. In other words, people who struggle with perfectionism, your brain behaves like something is wrong long before anything actually is wrong. It's constantly scanning your environment. It's waiting. It's braced for a mistake. Over time, your entire body starts to operate like a smoke alarm with a too sensitive sensor. A tiny uncertainty can set off a full internal alert, like if smoke from a candle set off all of the fire alarms in your house. And that's why perfectionism feels exhausting. Your body is overreacting, but not in the way that people think. It's reacting as if any small stimulus is a very real and dangerous threat, because to a trauma-wired nervous system, that is the learned survival pattern. Your body is doing exactly what it has learned to do, stay alert to prevent you from getting into any danger. And here's the part that is so very important to me that you understand. That overreaction was adaptive once, which is a word that means it actually was helping you at one point in time. It was working for you. That's why your body's still doing it. When you were in environments where unpredictability, criticism, or punishment were very real possibilities, this level of vigilance kept you safe. It helped you to anticipate emotional shifts, avoid conflict, and prevent consequences that you didn't want to have happen to you. But our nervous system doesn't update itself just because your circumstances have changed. It doesn't say, "Oh, great, we're safe now." It keeps using the same strategy that worked back then, even though you don't need it now. That's what a trauma response is: a survival skill applied in the wrong context, a smoke alarm that goes off when you toast bread instead of when there's an actual fire. So when perfectionism kicks in at work, during charting, during simple everyday tasks, That's not you being dramatic. It's your body doing what it was trained to do. It just hasn't learned yet that you don't need that level of protection anymore. And here's where medicine complicates things even further. Because unlike in other professions, in medicine, the stakes are really high. Errors can cause real harm, and systems are often punitive instead of supportive. We've all seen it on the news where medical errors end up with people getting sued or facing the potential of very real prison time. Colleagues can sometimes turn on each other out of their own fear of being blamed. So your body gets mixed messages. Part of your life may be safer now, but your work environment can still reinforce the idea that vigilance equals survival. It's confusing for the nervous system because in some ways that danger isn't entirely gone. So your body is a threat detector. And you end up practicing medicine, and I ended up practicing medicine and living my life like I'm walking on a tightrope. So here are 3 lessons that I wish medicine taught us from day one. Number 1, uncertainty is not incompetence. Some of the best clinicians I know doubt wisely. And what I mean by that is this. Wise doubt is targeted, not global. It isn't thinking I'm a terrible doctor. It's the situation is complex. Let me slow down and think it through. This is the difference between self-doubt and situational doubt. Self-doubt can collapse your confidence, but situational doubt can sharpen your decision-making. Wise doubt sounds like, do I have enough information to move forward? Is there anything here that doesn't fit the pattern that I expect? And should I ask one more question or check one more lab report or vital sign before I make a decision? Wise doubt invites curiosity, not shame, and curiosity keeps our patients safer than fear ever has. And number 2, honesty can build our trust much faster than being flawless. Patients don't need superheroes, and honestly, if they did, AI really would take my job away. Because algorithms are far better at being flawless than humans ever will be. But the truth is, AI can analyze data. It can't sit with someone's fear. It can't hold space for grief. It can't listen between the lines or notice the things that people don't say. Compassion, curiosity, and connection will get you further with patients than perfection ever could. And these are things that no AI algorithm can ever replace. Patients need humans, need people. Flawlessness creates a distance, but honesty creates connection between us. And when we tell the truth, even when it's uncomfortable, then we're giving our patients something they can rely on, which is our integrity. And number 3, your identity, my identity, cannot be built on performance. Because if it is, I'm never going to feel like I've done enough, even on my best day. Performance can always be taken from you by illness, by exhaustion, by one unexpected shift. But identity that's built on integrity, humility, and compassion stays steady, even when the entire world is shaking apart around you. So, how do you actually build an identity on those things? Well, you practice them in small, daily ways. Integrity becomes your identity when you tell the truth, even when it's inconvenient. Humility becomes part of who you are when you allow yourself not to know something and ask questions to learn more. Compassion becomes your identity when you extend it not only to patients, but also to yourself, especially when you make mistakes. Identity isn't only a declaration that we speak over ourselves. It isn't just a morning mantra. It's a repetition because we become what we practice most often. So here are the tools that I'm using every day to try to loosen perfectionism's grip, and more context for how each one works in real life, especially in medicine. First, I'm naming my fears. Instead of assuming that I'm just feeling anxious because I'm failing at some vague, undefinable thing, I ask myself, what danger does my body think it's protecting me from right now? In medicine, that fear is often real, harming a patient, being judged on rounds, getting written up, or even humiliated publicly, which unfortunately happens quite a lot, especially to medical students and residents. But it's even still happened to me after I started practicing after training. Naming the exact sort of fear, what it is that I'm facing in the moment, can pull me out of shame into clarity and help me to figure out what it is that I actually need in that moment to move forward. I also practice good enough. Perfectionism loosens through repetition, not necessarily just insight. Just because I know that I'm struggling with perfectionism doesn't just automatically make it go away. But I can choose 1 or 2 low-stakes tasks every day: answering an email or a text message, folding the laundry, doing the dishes, finishing a note, or reading on my continuing medical education. And I can intentionally stop and say, let's let that be good enough. It can feel really awful at first not to run everything through 3 or 4 times to make sure that it's perfect, but this is how you train your nervous system to tolerate imperfection without spiraling. I know I've talked about this in videos before. Having nervous system resets. If I feel myself tightening up and straining under the burden of perfectionism during the day, if I'm rereading something 10 times or looking up things that I know I already know, I use a physical interrupt, slowing down my breathing, shaking out my hands, stepping outside for a couple of minutes. This isn't just self-care, it's actual psychology that can help my body know that I'm safe enough to pause and calm down. And one of the best things that we can do for ourselves is honest but compassionate self-talk. Instead of the old voice that we have running through our minds that says, don't mess up, or everyone is judging you, or you should be so ashamed of yourself, use grounding language. Say, I am allowed to be human here. Nothing is on fire. No one is currently dying. I have space to slow down. If I make a mistake, I can fix it. I am here to learn because I care about helping people. That's not toxic positivity. It's not even really positivity. It's recalibrating your internal mind back towards reality. This is not about lowering our standards. This is about lowering our fear levels. If perfectionism has shaped the way you practice medicine or the way you exist as a human, I'd love to hear your story. I've been talking with both clinicians and patients about how perfectionism and trauma shape our lives far more than we realize. You can share your story in the comments, DM me on LinkedIn, or send me an email. And if you're interested in a deeper conversation about the human side of medicine and healing, make sure to subscribe. It helps this content reach the people who need it the most. I am doing research here because I want to build resources that help clinicians and patients navigate these pressures that we all live with in a healthier, more humane way. I want the things that we teach each other to be evidence-based, compassionate, and actually useful. And your stories and what would really help you guide my work. So let's start naming the pressures that we were taught to hide. And remember, you don't have to be perfect in order to be trustworthy. You just have to be human.